Hi, my name is Jacob Cooper. I'm a student nurse practitioner. Today I've seen Vanessa. I'm going to give an oral report. Vanessa Johnson is a 64-year-old African-American female who presents to the clinic today because her daughter forced her to come, but she's also been experiencing some feelings of fatigue. Feelings of fatigue started roughly 4 or 5 months ago, and they occur every day. Her fatigue is exacerbated by exertion and is relieved after taking periods of rest. She rates the severity at a 6 or 7 out of 10. Last time she was seen by a physician was roughly a year ago. Ms. Johnson has a pertinent medical history of type 2 diabetes and hypertension. She is non-compliant with her current medication regimen, although she is prescribed atenolol, hydrochlorothiazide, glyburide, and metformin. Of the medications she is prescribed, she is compliant only with her atenolol, which is 25 milligrams daily. Ms. Johnson has an intolerance for her prescribed metformin. As she states, it causes her GI disturbances such as cramping and bloating. She does not have any medication, allergies, or food intolerances. Ms. Johnson has not had any recent surgeries or hospitalizations. Both of her parents are deceased. Her father died from a myocardial infarction, and her mother had a history of diabetes. Her sister is still living but has cardiovascular disease. Ms. Johnson is a widowed mother of one child. She denies being sexually active at this time. She denies tobacco, recreational drug use, or alcohol consumption. A 12-point review of systems was completed today and was mostly negative, with exceptions to general, HEENT, GU, and psych. The patient is well-groomed, calm, and cooperative. She appears comfortable today. The patient feels fatigued most every day. She has experienced a 5-pound weight loss over the past year. Additionally, she's complaining of occasional dryness in bilateral eyes and experiencing mouth dryness. She has noticed increased thirst over the past few months, as well as an increased frequency in urinating. She experiences sleep disturbances due to waking up at night to urinate. The remaining body systems were negative. Vanessa's vital signs appeared normal, with exceptions to her blood pressure and BMI. Her blood pressure today was 160/90, and her current BMI is 29.6. A complete physical exam was completed. Vanessa is alert and oriented to person, time, place, situation. Her eye exam revealed diabetic retinopathy bilaterally. Her heart was a normal rate and rhythm. No murmurs or rubs upon auscultation. No peripheral edema was noted. Her chest expansion is symmetrical. Bilateral lungs were auscultated and appeared to be clear. No wheezing or crackles noted. Bowel sounds were active and noted in all 4 quadrants. Today I would like to order a CBC, a TSH, T4, lipid panel, hemoglobin A1C, and a UA. My primary diagnosis I'm thinking for Vanessa is essential hypertension and uncontrolled diabetes mellitus. Because of her non-compliance, her feelings of fatigue could be related to increased cardiac workload and chronic hyperglycemia. Additionally, the increased frequency in urinating and complaints of mucous membrane dryness and blurred vision may also be related to uncontrolled diabetes. My differential diagnoses today are diabetic retinopathy, generalized fatigue, and hypothyroidism. Her TSH and T4 levels were unremarkable, which limits the concern for hypothyroidism. As for her labs, her hemoglobin A1C was elevated at 8.5%. The other labs were unremarkable. All right, so from the plan, for medications, I would like to increase Vanessa's prescription of atenolol from 25 milligrams to 50 milligrams and restart her hydrochlorothiazide at the same dosage and time. And then I would also like her to resume her glyburide at the same dose and time. And then for metformin, continue to take twice daily, but reduce the dose from 1,000 milligrams to 500 milligrams to see if that alleviates her GI disturbances. For non-pharmacological recommendations, I recommend that Vanessa make some diet modifications and increases some of her exercise practices. I instructed her to limit her sodium intake and consumption of fast food. I instructed her to take her blood pressure each morning, document the result, and bring the document to the follow-up appointment. As for the diabetes, I would like her to start checking her blood sugar once daily rather than twice weekly. As for referrals, I would like to refer Vanessa to endocrinology to assess her current pharmacological plan and follow up on her elevated hemoglobin A1C. I would also like to make a referral for ophthalmology so she could be seen for her diabetic retinopathy and begin a treatment plan. Vanessa's last mammogram was 7 years ago. I educated Vanessa that it's time to get a mammogram and a colonoscopy due to her age and increased risk for breast cancer and colorectal cancers. And I would like to see Vanessa back here in 3 or 4 weeks to see how she's doing, if her symptoms of fatigue have improved. And I would also like her to see the endocrinologist first before the follow-up to go over that appointment as well. Thank you.